Today, we're going to talk about the 6 top symptoms in menopausal women. Menopause is not a disease condition, but it's really just a time of transition in a woman's life. She goes from being fertile and able to become pregnant, having a monthly cycle, to having her hormones be reduced, so that all comes to an end. Hi, I'm Dr. Mona Morstein. I'm a naturopathic physician. I've been in practice for 36 years. Welcome to my channel. Now, if you haven't already subscribed to my channel, please click below and let's get started. And when a woman has not had a period for a year, then we say she's in menopause. Now, the top 3 hormones in a woman that can decrease with menopause are the estrogens, the progesterones, and the testosterone. A lower level of each of those can cause individual problems in a woman. Now, women tend to have menopause around the age of 52 on average, and these symptoms can develop sometimes even before menopause, but certainly most definitely within the years right after menopause. Sometimes they settle down as the years goes on, and sometimes in some women they don't. Now, what are these symptoms that we're talking about? Well, the first one, certainly the most well known, is the vasomotor symptoms, also known as hot flashes during the day and night sweats during the night. These are sudden surges of heat that kind of come out of the blue. Although there are certain factors, alcohol will always have a menopausal woman pretty much have a hot flash within 10 minutes. Spicy foods, sometimes just really hot foods, a cup of hot tea, being in a hot environment. These are all very common switches to have this sudden feeling of heat that can start and then spread throughout the body, and also may bring sweat with it. And sometimes that sweat can be bad enough a woman really has to change her clothes. Now, if it happens during the day, that's one thing. At night, of course, it can lead to a lot of sleep difficulty if they're happening several times during the night and the woman is waking up and having to cool down, potentially change her pajamas, and so forth. If this happens just once or twice every 24 hours, most women can live with that. But it's happening 10, 20 times in 24 hours, that is going to really reduce the quality of life in a woman. Another one is vaginal atrophy. Estrogen, that hormone, like the one related to the vasomotor symptoms, is also involved in keeping the vagina kind of moist and puffy and produce lubrication when sexually aroused. And so it's very common that in postmenopausal women, they can start having a vaginal wall that gets dry and doesn't really lubricate and can also actually shrink a bit. And the opening into the vagina can shrink a bit. And so obviously, this can produce some significant discomfort with intimacy. That can also affect the libido and the enjoyment of that intimacy. This is something that we oftentimes have to work with in postmenopausal women. Another is just sleep. Of course, I've talked about sleep being disturbed by night sweats, but this progesterone, which is a hormone most associated with sleep outside of the vasomotor symptoms, when it breaks down, one of the products it breaks down to is allopregnanolone. And that actually quiets the brain and relaxes it and helps a woman fall asleep. It can be very difficult for postmenopausal women to sleep well with lower progesterone. In fact, postmenopausal women is the #1 population for sleep disorders, right? So we have to look at that as well. Another is weight gain. During the years when a woman is having her periods and is fertile, her fat tends to deposit in her hips and her butt area, giving her that pear shape, which is actually metabolically protective. We don't become insulin resistant with the female pear natural shape. But postmenopause, when the estrogens are lower, then when weight happens, which can happen because women are getting older, maybe they're not exercising as much, maybe they still have some eating habits that worked for them when they were 30, when they had more of metabolism, but now is a little too many calories when they're older, and so they are gaining weight. And now, postmenopausally, it doesn't get in the hips and butt, but it comes into the abdomen. And women tend to have more risk of getting the apple weight gain, which does cause insulin resistance and potentially prediabetes and diabetes. This is one thing we have to look at with women. Obviously, it's not just estrogens, it may also be their diet and lifestyle and other things that have to be put in balance. But definitely, the lower estrogen does put the weight here. And especially when the estrogens are low, but women are getting too much testosterone. Now, I'm going to talk about that in another lecture, so keep watching. Another symptom is bone and muscle loss, and that can be from low testosterone and a little estrogen, but testosterone for sure is related more to muscle building and bone, and estrogen is also related to bone strength. Again, we do need to exercise and we need to eat a diet that doesn't promote bone loss and run the risk of getting into osteopenia, which is losing a little bone mass, and osteoporosis is losing a lot of it. But these hormones, when they're decreased, there is higher risk of losing muscle, of losing bones, and setting up a woman having a problematic fracture with a fall, for example. Then the sixth change is mood changes. And it's not uncommon for postmenopausal women to have more anxiety, more depression, more irritability. And this relates to the estrogens and progesterone and how they work in the brain. How, are you having a lot of vasomotor? Are you losing sleep? All these sort of things help with mood regulation. Those are the 6 main symptoms, right? With vasomotor, with vaginal atrophy, sleep, weight gain, bone and muscle loss, and mood changes. Those years don't have to be years of discomfort. We can treat those really naturally and help a woman regain balance and really soar happily through those years. So, I'm Dr. Mona Morstein. I hope you liked this lecture. If you enjoyed it, please leave a like and please subscribe. If you want to click my bio below, then you can learn all about me and also book an appointment. Thank you.